operate systemic change, because obviously there are structural issues, as you say, when you have that level of disproportionality.
I think if there was more diversity in government decision-making, again, beyond just ministers are important, of course, in this, I think that's a good thing. And an example of that I may give, if it's okay, relevant, I think it's relevant to this inquiry, is that when I was Health Secretary, one of the things that I think it was very important to me and I took very seriously was the health disparities, including racial disparities. And one of the reasons I took sort of racial disparity health outcomes, I guess, more seriously than perhaps some of my predecessors was because of my own experiences. And so I think there are some clear cases where having more diversity can only be a benefit.
Indeed, and presumably would assist in decision making.
Yes.
If I can move then now to deal with your time as Secretary of State, as I say, and look at some of those decision-making and structural arrangements that were in place then. You came back into, as I say, into a ministerial role in June 2021, so a latter part of the pandemic. And by that point, a number of decision-making forums at Fora had been operating for quite some time. So you had the 8:30 a.m. meetings, COVID-O and COVID-S, is that right?
That's correct.
And so at the point when you came back in, there was a rhythm in terms of decision making and those meetings.
Yes.
Now, just dealing, if I may, with the 8:30 a.m. decision making meetings, that's the primary meeting as far as you are concerned, which involved decision making. Is that right?
It was probably the most important meeting, of the day. And as it suggests, every morning at 8:30, and certainly when I first became Health Secretary in June 2021, those were daily meetings, including most weekends.
And just
meetings, including most weekends.
And just to deal with those individuals that were in the room at that point, that's the Prime Minister, other relevant ministers, as and when needed, heads of the NHS, and the Chief Medical Officer, Chief Scientific Advisor. So a broad range of people.
Yes, and a number of the Prime Minister's advisors.
Indeed.
Yeah.
And then just dealing with decision-making from the centre, can I just take you, please, to paragraph 43 of your witness statement at page 14?
Yeah.
What you do say in relation to that is that a lot of the decisions made from the centre were made at the last minute because of lots of back and forth between the departments. And so as the consequences of that are really what I'm interested in. That seems to be...
Yeah.
And what we see there is that resulted in decisions being made shortly before they needed to be implemented, which caused confusion and problems with effective communication to the public and to others. Can you give us an example of that, please?
Yes. So of course, my Department of Health and Social Care, was overall responsible for health. Like many things with health, but especially during the pandemic, a number of the decisions that were being made, and I think in this paragraph I've used an example of travel restrictions, that other departments would have a huge involvement. And in some cases, they'd be the lead on any potential travel restrictions. And so an example would be when the Department of Health may have a view that on travel restrictions, be it on testing or certain countries. For example, there was a colour coding of countries at the time. Then that would be a view of the Health Department, but it would require a government decision. But in coming to that decision, the view of the Department of Transport would be very strong as well, and strongly taken into account.
And would that decision then would that decision be made with you initially and then change subsequently?
No, I wouldn't go as far as saying the decision would be made with me. It would be that I would have a view on that, and come to, rather than a decision, I would describe it as a view or recommendation for the government. Have a clear view. and that would be based on the advice that I was getting, the judgment call that I was making. And I would feed that view in probably formally through the Cabinet Office. There may be some informal discussions at or actually at the 8:30 meeting, or maybe at the end of the 8:30 meeting with one or two of the people that were around the room. And then there would be typically a formal meeting on that decision, and that would be either a COVID-O or COVID-S, depending on the type of decision, and that would be led always by the Cabinet Office, and there'd be ministers representing the relevant departments around the table, or if it's heard virtually in that way, and then a decision would be made based on the discussion and also the paper that was provided for that meeting.
Thank you.
And the paper would be provided by the Cabinet Office.
Thank you. If I can now take you to COVID-O and COVID-S. You were not an attendee at COVID-O, but you did attend COVID-S.
That's correct.
And you set out within your witness statement, I'm not going to take you through them, a number of different decisions and strands of work that you were involved in within COVID-S. A large number of them relate to vaccines, and indeed a large part of your mandate at that time related to vaccines. You're aware that will be the subject of a later module, and so we're not going to deal with that today.
Yes.
But dealing with COVID-S, and we've heard a little bit about that already in the COVID task force that was in place by this stage. I just want to deal with some of the challenges that were faced within that environment. And one of the ones that you raise in your statement is that late delivery of papers for meetings, agendas and supporting papers and submissions documentation. You provide 3 reasons for that. The first of which is that it's time sensitive, and so it unfortunately couldn't be avoided. An issue arose, had to be dealt with. The second of those is leaks, and you raise that as a significant issue.
Yes.
Now, you've sat on a number of other committees decision-making for us, including the National Security Council. Has that ever been a problem previously in those situations?
Not in the National Security Council, apart from one well-known instance. But other than that, I think certainly of all the cabinet committees that I was a member of, the National Security Council was the one, again, notwithstanding the one exception, that never leaked. And I think that would be given the nature of the subject, the sensitivity, I think most people understand that, and clearly that was a good outcome that it didn't leak. Otherwise, within government, if your question is, had I seen leaks of so many...
Had you experienced the same level of leaks before at any other point in your career?
Yes. During the Brexit negotiations and discussions when I was, especially when I was Home Secretary.
Thank you. And then if I can deal with your the third reason, you explain, indeed it's within paragraph 45 and it's here and pulled up on the screen. In relation to that sometimes infrequently papers were only circulated shortly before the meeting in order to ensure that a particular option was chosen and or to prevent other options being put forward. Effectively as a fait accompli. Just dealing with that, can you give a very brief example of when that arose in relation to the COVID response?
Yes. Again, I would probably draw the example of travel restrictions. We had many meetings on which countries, for example, should be on the red list, the amber list, and so forth, or whether we should have PCR tests for people coming into the country or LFT tests and discussions of that nature. And with those in particular, I felt that there'd been some sort of small group meeting excluding my department in advance, and there'd been some decision led by the centre on what the outcome should be, and that's what the Cabinet Office were charged with, making sure the outcome was. And because it's a collective decision of the committee, that's often the way that it went, because I might have a different view. And many of these meetings, Jenny Harries might be presenting the health case, or the CMO, or other health experts. But I felt sometimes the decision was predetermined.
But is there anything unusual in that, Mr. Joad? I've chaired a number of committees, and I'm often given pre-meeting briefings. And I often used to say, so what is the advice you're giving me that you think this committee should, what decision do you think the committee should reach? So there's nothing unusual in there being a pre-meeting meeting.
There's nothing unusual about that at all. I think it depends on what one believes should be the objectives of that meeting. So the pandemic, the issues were very fast moving, very fast developing, and there may well be very relevant information that my department might have, or indeed some other department, that is very relevant to that discussion that hasn't been taken into account because the pre-meeting just doesn't have that information, or perhaps they just
So that's not my point. So forgive me, I wasn't myself clear. I mean, when I was in this position, and I'd have a pre-meeting briefing, and I'd say, okay, so the advice that you think the decision I ought to take is X, or the board ought to take is X. And then I would go into the meeting and see what people said. But I relied on the strong members of the board to come up with the kind of information you had, even if I'd been told what the preferred option was.
That's right. And so in the examples that we're discussing here, in these meetings, if there were COVID-S meetings, I would typically be at that meeting. I would make the case strongly on behalf of what I believe is right, what my department believes based on the evidence is right. But sometimes I felt that no matter how strongly I make that case, it just wasn't going to. The decision had just already been made, and it wasn't going to be fully taken into account, no matter how strongly I made that case.
Thank you. Moving then, if I may, to other meetings and other relationships, you explain that you had a relationship with your counterpart in opposition. And
yes.
How would you describe that relationship? Did it work well?
Very good and constructive. There were two counterparts I had during my time as Health Secretary, and with both, I would describe them as good and constructive.
And in dealing with the relationships between your team and you and your department and the devolved administrations, and with specific respect the COVID-19 response, you explained that you had weekly meetings. Was that something that you instituted?
It was something I instituted, as in the sense that there were not weekly meetings planned when I arrived in the department. There were meetings, and I'm not sure how regular they were between the then Health Secretary and his counterparts in the devolved administrations. But I felt from day one that it's really important to work together, to listen to each other, and not least because obviously I came out of the United Kingdom, but I also understood that England as a administration was making a lot of the key decisions that would affect other the devolved administrations, such as on travel we talked about, which is not devolved, the vaccine decisions, and I thought it was important to be working well together and, where possible, to coordinate, especially on vaccines, because I thought it was a huge issue of public confidence if we all were seen to work together in tandem and say the same thing.
Indeed, within your, again, as I say, we're not going to go into the issue of vaccines today, but within your statement, you give an example of an occasion where there was potential divergence, but they worked together to ensure that one single joint message went out.
Yes, and we had all, even before I became Health Secretary, I think there was a general understanding to accept the advice of the JCVI, the expert committee that advised England and Wales on vaccines. So for the other devolved administrations in Scotland and Northern Ireland, voluntarily agreed to accept that. But also to, when decisions were made by the JCVI, to make sure that all the CMOs of the devolved administrations were aware of that, and that when it went public, that we did it at the same time.
And alongside those formal meetings, there were also informal communications. You had a WhatsApp group, effectively, between the various health ministers.
Yes.
Thank you.
Yes, and I felt, and I did think there was an importance to that, because I wanted the health ministers and devolved administrations to know that they didn't just have to wait for a sort of Thursday or Friday meeting when I typically had them, that they could contact me both formally through our respective offices, but also if they had a question they wanted to reach me, because things were so fast moving, there were developments all the time, that they could contact me whenever they felt it was appropriate, any time of the day, 24/7. I didn't mind.
Now, you will have heard various things being said about the use of WhatsApp during the pandemic. Did you find that to be a useful tool, or were there any disadvantages?
I find it to be a useful tool. I mean, for the purposes of that type of communication, yes, obviously there were other things that it would be not useful, but in general, I found it a useful tool.
There was a point later in the pandemic, in November, when the Welsh Government and the Scottish Government called for a COBRA and wrote a letter to the Prime Minister. You replied to that letter. There's no reference within the letter to a COBRA subsequently taking place, but is it right that a COBRA was convened as a consequence of those requests?
I believe it was convened as a consequence of this request. That's correct. I also believe, if I remember correctly, I think the First Ministers did not write to me. They wrote to the Prime Minister. I was asked to reply on behalf of the Prime Minister, which is not unusual, a department replying on behalf of the Prime Minister. And very soon a decision was made by the centre, because it's always a prime ministerial decision to hold a COBRA, to go ahead and have a COBRA, which I believe, if I remember correctly, I think Michael Gove, the CDL at the time, chaired.
He did indeed, and we will move to that when we look at some of the decision making. It concerned Omicron.
Yeah.
But in relation to that, was that the first COBRA that had been convened since you took up office in June of 2021?
Since I returned to government, I believe so.
Thank you. Now, what I'd like to do now, Mr. Javid, is turn to your role as Chancellor and just have a look at how the situation developed in relation to COVID-19 through January and February, from your perspective in the Treasury.
Yes.
It's fair to say that your involvement was relatively limited because of your limited time within that position.
That's right.
But in regard to the COBRAs that we've already heard about in late January and early February, is it right that you did not attend any of those?
That's right, I did not attend.
And can you recall if you were sent any notes of those at all?
Notes, first of all, I did attend, but that doesn't mean to say the Treasury didn't attend.
The Treasury were represented.
Yes, so if there was a COBRA, I would expect there will always be a Treasury representation. And it may well also be a senior Treasury representation. And what I mean by that is that the Treasury is the only department that has two cabinet ministers. So it could be the Chief Secretary attend, so it's still very senior representation of the Treasury. Also, it would be, I can't think of a single instance, I think, where a Chancellor would attend a COBRA that is not chaired by the Prime Minister. So I think those COBRAs you're referring to were all chaired by the Health Secretary.
They were indeed. I'm going to move to that now in terms of why you did not attend. And you refer to effectively a convention, an informal rule in relation to COBRAs, that the more senior the individual in the chair, the more likely it is that other ministers will attend. Now, at that time, it was the Minister for Health and Social Care. And you, at that point, were the Chancellor, so you occupied one of the four great offices of state, so ranked effectively above him. Would that be the reason that you did not attend on that occasion?
I don't... it's not the reason, as in if there was still a good reason to attend, I would have attended. But the COBRA, when it had been called, typically what would happen is my department would be told, my private office would be told, and we would normally, based on the private office, would give advice based on who's called. All the COBRAs will be called by the Prime Minister, but who's attending, basically who's chairing the COBRA, and they would have known it's being chaired by the Secretary of State for Health, which would indicate that although, because it's a COBRA, it's important, because that's what COBRAs are for, that if it was even more important, the Prime Minister would have chaired it, or perhaps if there was some particular unusual reason where the Prime Minister could not chair it, for example, perhaps he's travelling on some foreign business and the COBRA had suddenly called, then there might well be a request for the Chancellor to attend, but there was no such request, as far as I'm aware, for the Chancellor to attend, and that would explain why the other ministers in the Treasury would have attended.
And just dealing with that point in terms of when the Prime Minister chairs a COBRA, that in and of itself is a signal, isn't it, across government?
Yes.
And COBRA is an effective lever in that respect.
Yes.
Going back to those cross-governmental issues that you were talking about earlier.
That is correct.
Now, dealing with the COBRA and COVID update, you were provided with a short briefing on coronavirus on the 24th of January of 2020, and that's INQ 000328748. And we see that here. It gives details of Professor Sir Chris Whitty's update at the COBRA meeting. Effectively, nothing really new aside from that was already being reported in the news at that stage. It just then goes on to discuss the triggers. It will be the responsibility of the CMO to assess whether those points have been met. Thought that the outbreak development will move fairly slowly. It will take a few weeks before it is an issue here. As I say, this is the 24th of January.
Yes.
Of course, things much more rapidly than that, and the first cases were notified on the 31st, less than a week later.
Yep.
And it talks then about the other triggers for reassessment. The next line down reads, the risk to the UK is low and is expected to remain low.
Yes.
What was your understanding of that? Did you understand the risk being low to mean as at that day? Or did you understand it in terms of the expected to remain low for the immediate future, short term or medium term?
I would have understood expected to remain low for the sort of in the sort of next few weeks, next couple of months is expected to remain low.
And then the remainder of the update really deals with the response in terms of ports and what was taking place there, leafleting and so on. In respect to the Treasury's focus at that time in relation to the potential pandemic, is it fair to say it was very much focused on the impact on the Chinese economy and any potential overspill in that regard in terms of the global economy in the UK?
Yes, I'd phrase it slightly differently if I may.
Of course.
It was considered, the Treasury was concerned about the impact on the UK economy.
Of course.
Primarily the UK economy because of what was happening in China, given this fact that China was the second largest economy in the world, and also as an open trading nation, the UK would clearly be impacted by that.
Indeed, if I can just bring that up for one moment, it's INQ 000328752. This is a submission that you received on the 5th of January. It's a briefing about the impact of COVID. As I say, as you identify, it predominantly focuses on the Chinese economy, but in terms of its potential impact on the UK in that respect. Is it reflective of how the threat was being viewed by government at that point, that any impact would be relatively limited and very much viewed through the impacts or trickle-down consequences of the impact on the Chinese economy?
Yes, so this is 4th of February 2020. And as you can see, this is a note to me from the Treasury team. And as we just referred to, I think it sort of is very much focused on the economic impact from the UK from a sort of China slowdown, perhaps international travel restrictions. Your question, is this a fair reflection of the view of government? I think because it's focused on the economy, it's more a view of the Treasury. But the input into this in terms of the pandemic and the pathway, I guess it wasn't even necessarily referred to as a pandemic then, but this new virus would have come from the health department, notwithstanding the Treasury itself does have scientific advisors as well.
Of course. And you then sent a subsequent letter to the Prime Minister regarding the economic impacts of COVID-19.
Yeah.
That again was sent in February of 2020.
Yeah.
Setting out how effectively Her Majesty's Treasury, as it was then, saw the key risks to the UK economy. At that stage, we see here on the first page, it's the risk to the global economy. If we go to page 3, please. It sets out the potential risks to the UK economy.
Yes.
Effectively, if the impact of it deals firstly with the economic impact would be largely from a slowdown in China, could be in the range of 0.1 to 0.2 percentage points. However, the impact of an outbreak of COVID-19 on the UK economy is highly uncertain. It then goes on to explain it's really, as you can see here, it predominantly focuses on supply chains and employment and time in work. Those are the areas in which it focuses. It then continues to set out the initial Treasury analysis. It bases it on a reasonable worst-case scenario of a UK pandemic flu outbreak. It explains 50% of the UK workforce are infected, 2.5% mortality rate, and a duration of 4 months. So as I say, this is based on this is based very much on the UK pandemic in terms of a flu pandemic.
That's right.
It's starkly different to what was eventually to eventuate.
Yes.
Sorry, that's one of that. With references to gross outputs and GDP falling of 1.5 to 2%. And of course, as we know, it was much more significant than that.
Yes.
And the pandemic lasting significantly longer than 4 months. Did you receive a response to this letter?
Was on the phone, and the advice was that having flight restrictions with China would have very little impact, and so it wasn't worth it.
Indeed. And you ultimately accepted that
Yes.
advice. You later were to raise concerns within the Treasury about the possible wider economic impact of COVID-19 beyond the Chinese economy and import-export. Is that right?
Yes, I believe so.
And then we come to a stage where obviously on the 13th of February you resigned, and that ceased your involvement then.
That's right.
With regards to COVID-19 response.
Yes.
At that stage, just taking again that part very briefly, if I may, you went to the back benches.
Yes.
You very much took, and you explained within your statement that you took the decision not to get involved with any of the groups that were being set up or in lobbying or anything of that nature.
Yeah.
And so was not involved within the government response until the following June of 2021.
That's right.
There was some communication between you and Matt Hancock in relation to borders in January of 2021. Do you recall that in terms of a WhatsApp conversation?
Yes, I think I do.
Again, raising why haven't we closed the borders? You explain it should be for all travellers, the benefits outweigh the costs. And the response that you get is, have you raised that with the boss, i.e. the Prime Minister? And you explain that you're doing lots of research on the pandemic generally.
Yes.
Did you ever raise that with the Prime Minister at that time?
I don't recall raising it with him. I wasn't in government.
Of course.
Yep.
Now, turning now...
Sorry, if I may just add, I think I was just thinking about why it was to do with the Delta variant, which was, I think at that time, very prevalent in Southeast Asia. And we had a lot of flights in and out of Southeast Asia. That's why I raised it. And also, and you slightly alluded to it, but I think it's important, is that although I was on the backbenches and not in government, one of the things I did take upon myself at that time was I became a senior fellow at the Harvard Kennedy School, and to do a research project, and the research project was on the pandemic, and broadly how countries in general at that time were responding to it, and how they were taking different approaches, and I was trying to understand that and trying to think about that in the context of what the UK was doing. So during that process, I was doing a lot of research. I talked to a lot of people. I talked to ministers in other countries. I talked to epidemiologists and stuff. So my knowledge was based on that independent research that I was doing.
Indeed. I now want to go into to deal with your time as the Secretary of State for Health and Social Care, if I may, in June of 2021.
Yeah.
Now, just so that we can just fix that in terms of the timing, the roadmap had been published earlier that year out of lockdown. Step 4 was due to take place on the 14th of June, but had been delayed until the 19th of July. So it was within that period.
That's right.
Subsequent to that, on the 14th of September, Plan B was announced and then implemented on the 8th of December. And then face masks and so on came in on the 10th of December. So it's that period that I'm now focusing on, if I may, and then moving into Omicron, the new variant that emerged in November of 2021.
Yes.
Now, you came in, as I say, in June 2021. partway through that roadmap. Your initial involvement was it in discussions concerning the lifting of restrictions that were to come?
Yes, when I arrived in the department, which I believe was the 26th of June 2021, the main discussion that was going on with respect to the pandemic within government was what's the right time to move to step 4, so the lifting of some of the restrictions.
At that point, it had already been pushed back.
Yes.
And the 19th of July, was that a date that had been alighted upon?
Yes, and also another date that had been alighted upon was the 12th of July as a decision day.
Do you recall communications referring to it as Freedom Day?
When you say communications, what do you mean?
Government communications. How it was being packaged.
No, I do recall hearing references to July the 19th as Freedom Day, but if your question is within sort of government documents no, I don't.
Was it a government strategy in terms of outward-facing communications, to your knowledge, either within the DHSC or within Number 10?
Not to call it Freedom Day. In fact, to the contrary, I recall it saying very clearly during the lead up to July the 19th that we as in government, we must be clear that it is not Freedom Day. So it's really important that whilst we remove some of the statutory restrictions, that people in general don't feel that the pandemic's over, everything's back to normal, because far from it. The pandemic was still, the virus was still very much around, and also there's a bunch of other measures and restrictions that will stay in place. For example, around border control, the test, trace, and isolate policy. So it was really important, I think, to the contrary of Freedom Day, it was anything but Freedom Day.
In terms of your position and restrictions, at that point, were you advocating for a loosening of restrictions?
I was keen to see a loosening of restrictions if the evidence allowed it.
And did you consider that the evidence did allow it?
Yes.
In summer 2021?
Yes, I did.
Do you recall, if I may just call up Patrick Valence's notes, please, INQ 002739001. This relates to the 30th of June of 2021.
Yep.
A meeting with COVID dashboard. It's page 613. Thank you.
Yep.
ONS shows big increase in numbers since last week, nearly a doubling. Rates are very clearly up in children. It continues on, and we can see that Gavin Williamson, Secretary of State for Education, is in the room. You're also in the room. It records Gavin Williamson saying children shouldn't be asked to do things adults aren't, but then has no knowledge of the ongoing study. That presumably is a study into transmission. It then continues, the SAG comes in. Is that a reference to you?
I believe so.
Study will only determine the policy for next term, so that's school term, is it? That's a reference there?
Yes. I believe so. I mean, obviously, this is someone else's diary entry, but
of course.
I believe that's what it is.
It records that you started to make policy on the hoof with you and with the SAG and Williamson jostling for dominance and airtime. Do you recall what this related to?
I think so clearly this is Sir Patrick Valence's diary entry, as you've said. It's a sort of personal reflection by him about how he felt from this meeting. But I think what he's referring to is a very live discussion at the time, which was around the restrictions on school children, and especially around the policy at the time of if one child got COVID in a class and the whole class was sent home, and that was having a huge impact on schooling and ultimately the life chances of children. So it was a discussion about that. The other thing if I point out about this discussion, I think it is relevant, is that it's dated the 30th of June. But I'd only been in position for 4 days.
Of course.
Right? And so whatever information I had at the time, I'd had 4 days to sort of learn that, as it were, and obviously I learned a lot more in the coming days and weeks.
Can I just ask you about the last line? We see that Michael Gove also comes in and gets involved in the discussion.
Yeah.
It appears that no decision as a consequence is made. I'm afraid we don't know who says this, but somebody says afterwards they're very worried about their new Secretary of State, never wants to learn before a decision, will rush into macho right-wing decisions playing to the audience. Does that characterisation fit, from your perspective, fit what you were doing at that point?
No.
Thank you. And if I can then take you, please, to the discussions that were then going on in July. So again, you're very new in the job.
Yeah.
2nd of July of 2021, it's page 614. The same document, please. It's a further meeting. And what we see in this meeting is a difference of views between the Prime Minister and the Chancellor and Michael Gove and you in relation to what should you be doing and the return to work. Mask wearing, effectively what MPIs should be put in place. We see a more cautious approach being recorded in relation to yours and Michael Gove's views, and the Prime Minister and the Chancellor against that. What we see here is in terms of the situation update, cases are up, hospital admissions are up, the Prime Minister is downbeat, talks of grim predictions. You say we are going to have to learn to live with it and die with it, says Prime Minister. Do you recall that conversation?
I can recall me saying that we are going to have to live with it. I don't specifically recall the Prime Minister saying and die with it, but it's possible.
Are they the type of words that the Prime Minister did use?
It's possible, yes.
We see then the
It doesn't mean, just if I may just say on that, is that the Prime Minister in these meetings, he often said things that it's sometimes hard to determine between what he actually thought versus a joke or something, even when you're discussing something as important as this, or something to lighten the mood.
We see here the Chancellor is pushing very hard for faster opening up and the fuller opening up. At this point, the living with COVID strategy was still under development.
Actually, just pausing there before that gets misreported.
Of course.
It's not necessarily a reference by the then Prime Minister to lighten the mood. It could be taken in many ways. So I think we need to say that if it was said, which you don't necessarily remember, it doesn't mean it had that kind of intention. Things have got misreported, as you'll appreciate, over the last few weeks.
Yes.
So I just want to make that point. Sorry to interrupt.
Thank you.
I just want to continue down, if I may. And it continues to record some further discussion about making masks voluntary. What will ministers say? They will do sometimes I will, sometimes I won't wear one. And we see later references to that also. Are we going to encourage people to wear masks? Are we going to continue with this bollocks? It says he wants everyone back at work. We can't have the bollocks of consulting with employees and trade unions. They all need to come back to work, or the malingering work-shy people. And then goes on to ask or say, how much of the CS, presumably civil service, is back? How would you be able to tell? In terms of the consulting with employees and trade unions, was that something that the government was open to doing, or was this the general attitude towards government in relation to trade unions?
Other than the health trade unions, I wasn't dealing with the trade unions, and I think this is probably a reference to the wider sort of group of trade unions, and so I wouldn't have been involved in that.
And by the end of the meeting, what we have here is it ends by joking, please record, you've overcome my natural caution and bullied me into opening up. At that point, it's also recorded that the CMO and indeed Professor Sir Patrick Vallance had made the risks very clear. That's in relation to rising numbers, is that right?
I think that's right, yes. And it also says here, if I may point out, basically it is the PM and Chancellor against the more cautious Gove and Saj. And I think the cautious point refers to something you touched on earlier, Ms. Cecil, which is that it wasn't Freedom Day, right? And restrictions were going to stay in place, and it's really important to get that message across.
Is it fair to say that at various points in the autumn, as we move through that, you were also more cautious in terms of your advice?
Yes,
and lessening restrictions in general terms, although there are some exceptions.
Yes.
We move to the 5th of July, if I may, page 615. We see there, it's a COVID-0 reference. Cases are still going up, but the Prime Minister wants a considerable package of freedoms. We see in references to Gavin Williamson and schools. You come in to say the message is the pandemic is far from over. The link between cases and hospitalisation is weakened but not broken.
Yeah.
What were your concerns at that point?
First, it's something we referred to earlier, which is that the pandemic was far from over, that it wasn't Freedom Day. We still are in a pandemic. And yes, I felt, and maybe for reasons we might come on to later, that July sort of leading into the summer was the better time. There's no perfect time, but was the better time to try opening up. So I strongly felt that. And in the end, I think we made the right set of decisions around opening up in the summer. But what I wanted to get across was that people shouldn't get this message that it's over, and we must all remain cautious. Even if there's no government restrictions, people should be advised to remain cautious. For example, if they're meeting vulnerable people, if they're meeting elderly relatives, going to a care home, things like that. Also, there's this point here about the link between cases and hospitalisation is weakened but not broken. I did say that a number of times around this time because, well, I meant it. There was some sort of sense among some people, I felt, within the decision making that the vaccines meant that hospitalisation won't happen, or there'll be a lot less of it. And my fear was that yes, the link is weaker, which is good, in that there's less of a link between infection and hospitalisation, but there was still a link. And as I say here, it wasn't. We mustn't pretend or think that there's no link anymore. Clearly there was.
And we see here that the Prime Minister refers to the decision to postpone. That's step 4, presumably, of the plan. And indeed, it was postponed from June into July. He says it was the right one because it gave us more time to vaccinate those that we've broken the link between cases and hospitalisations. So is it fair to say you had different views on that link at that point between? Yes,
I think I was very concerned about that link, and I felt on the point, Ms. Esther, you just made about vaccination, is that time, that even a couple of weeks made a big difference in the pace that vaccinations were going, in terms of people either getting their first vaccination or their second.
If I may just deal with one discrete point, please, before the lunch and adjournment, and it just deals with DHSC. In the background to all of this, there were preparations, or certainly discussion about the winter, planning for winter of 2021. Is that right?
Yes.
As I say, I appreciate this is still very much within the infancy of your time as a minister. Were you aware of the Academy for Medical Sciences preparing for a challenging winter report that had been commissioned and circulated?
You mean by the 5th of
in July? In July.
I don't recall it specifically. I don't.